Hi, everyone. It's such a pleasure to be here with Dr. Shabnam Daskar, our Director of Medical Education at Live Younger. The other day was Blood Pressure Awareness or Hypertension Awareness Day. And I thought that we should really talk about hypertension because it is such a poorly managed risk factor for early death. I mean, I can talk about heart disease and heart attacks, and a lot of people go, oh, it won't happen to me. But I think when we say early death, it gets attention.
Yeah,
And one of the things I'm faced with a lot, whether I work in the ER, whether I'm seeing patients in the office, the first thing they'll say is, oh, I'm just stressed right now. That's why it's high, but it's not high at home. And some patients just go, I'm not prepared to take pills. That's not for me. I will do this myself. And I go, well, how long have you been trying? And they go, oh, well, yeah, I've been trying. Okay, so it's not working. Now it's time to do something, right? And, as much as in functional medicine, we try to de-prescribe medications, solve the root cause of the issue, and we deal with a population of patients who really don't want medication, right? For whatever the reason and whatever the situation, they come to us because they want root cause, avoid medication, or get off of their medication. But with hypertension, I find in my practice, and I'm sure you're the same, it's one of the earliest things we prescribe medication for.
yeah, absolutely.
I always say to patients, take the medication and then we can always take
Yeah,
you off of it
yeah,
because it is such a modifiable risk factor and it's criminal to
yeah,
not treat it in patients and lead to their early death.
yes.
So, some opening comments, and then also I want to keep everyone in the loop because I'm known for hormone health and helping balance hormones. I don't think too many people are aware that hormone health has a role to play in high blood pressure or hypertension. And then there's some other things that I'm really into right now that I think make a huge difference to hypertension and high blood pressure management. So I think, we'll try and keep it flowing well, but I want you to talk more about high blood pressure, why it kills people earlier. I'm being dramatic, but it does. It kills
It does.
people
No,
earlier.
you're right. If you say heart disease and stroke and dementia, people don't think, oh, that's something that's either not going to happen to me or it's many years down the line. I'm just in my 40s and 50s now. So, yes. So, number one, Natasha, you brought up so many things. I better make sure I'm getting them in order. Number one is hypertension and high blood pressure are the same disease, same condition. Recently, actually, I had a patient tell me, I don't have hypertension. I said, but you're taking a blood pressure medication. Oh, that's for high BP. So, hypertension, high blood pressure are both the same condition. Number two is hypertension because tension in many countries is considered to be stress. So, it's not only because of, stress that we haven't managed well. So, having blood pressure above a certain threshold is considered to be hypertension. Now, we will go into that threshold a little bit because things have changed. And worldwide, hypertension is not managed well, and there are various reasons. One is a lot of people don't have symptoms. Now, interestingly, a lot of women have symptoms like aches and pains, body ache, they feel little
Dizziness, headaches.
dizziness, headaches, and they don't always connect it to blood pressure. So while we say most people may not have any symptoms, some people do have symptoms which they may not always realize it's from hypertension. Number two, women have a little different, threshold. So first is the numbers. Number one is few years ago, a paper came out, and then the blood pressure management world changed entirely. So today the recommendation is the lower the better. Now here, Natasha, you and I have to qualify because I get attacked, when I say lower is better. So 120, that's the upper number, by 80 and below is normal blood pressure. Now, there have to be caveats because Dr. Iyer and I talk about managing hypertension with medication as well as natural therapies. Now, natural therapies, there are lifestyle changes, there could be supplements, a lot of things. But most of our colleagues, Natasha, are not thinking of therapeutic lifestyle change or supplementation when they talk about lower blood pressure numbers. They think of adding another pill.
Right.
Now, worldwide, Natasha, as you mentioned, more than 1 billion people have hypertension. Most of them
Wow.
don't have it under control. And there are many reasons. One of the reasons is that doctors do not always know what thresholds blood pressure should be at. Like the confusion.
Exactly. And in the old days, like when I started in Canada, in South Africa, never
Old
mind.
days,
But
Natasha.
in the old days, in the 90s, it was up to 140,
Yeah,
90 was
yeah.
acceptable, and we didn't act on it, right?
No.
And in the last 10 years, you and I have been very vocal about if you have insulin resistance
Yeah,
and diabetes, the number has to be way lower. Um, and 140, 90 is no longer accurate. We are looking for lower targets. 120, 80 is the max I like to deal with. Um, but so many people say, oh, but my doctor's not worried because I'm below
yeah,
140, 90.
yeah,
And it seems like the medical community itself has not kept up with the latest research, with the latest guidelines. And I think this is why it's so important that we make these videos, because patients themselves need to be educated and empowered to make their own decisions.
yeah. So when we talk about thresholds, and I said women, it's different. So studies have shown that 120 systolic in women is equivalent to a 150 in a man. So which means for women,
150.
yeah, 150 in men. So women ideally should be lower, so 110, 70 or lower. Now here again, all the caveats. This has not come into guidelines yet because see the challenge is for something to get into guidelines, we have to have sufficient number of studies done exclusively in women. These women have been followed up for sufficient length of time to show that yes, this is what it is. And as I said, in
Yeah.
most of the medical world we
So,
talk about
so,
medical.
so women need to be lower than
Yeah.
men, and
Yes.
we don't treat women as small men.
No.
So let's just talk about general targets. What should a person listening to us get into? Like
Yeah.
they are checking their blood pressure at Shoppers Drug Mart, or they bought their little machine and they're checking at home. What numbers are ideal for a patient?
So one is 120 by 80 for most people. Now here it gets complicated when we're talking about older adults on multiple medications. They
Okay,
need to
let's not
have,
talk about that. We're
let's not
talking to
talk
our
about,
audience.
we are talking about sort of
Right. So what is it?
most less than 120/80 for most. For women, it should be lower. And this is where the challenge comes is, Natasha, if they go to the doctor with a woman goes to a doctor with a blood pressure of 120 by 80 and says, no, I need it lower. Will you give me another medication? Most of the time, both doctor and I,
Not going to
no
happen.
doctor will give.
So that's why I insist on every person having a 24-hour ambulatory blood pressure monitor done, which is really cumbersome. You hated it. You
Yes.
absolutely refused. And I have to get it redone when it didn't work out the first time. So that's a huge obstacle as well, that people don't want to wear a cuff and a box attached to them for a whole day and a whole night. But it is so important to know what your blood pressure is throughout the day, and more especially what it is doing at night, because we have dippers and non-dippers. So can you quickly, succinctly tell us about what a dipper and a non-dipper
So
are?
studies have shown that in the like normal blood pressure has a rhythm. At night, it is supposed to fall by about 10% of the daytime numbers. Now, we won't know that unless we have a 24 ambulatory blood pressure test or we have a device like this. This is a device available in Canada and a few of the countries in the world called Actia. Now it's called Hilo. And reach out to us if you want to get onto one of these devices. We have a program in the clinic. So what it does is it checks your blood pressure at night. Now studies have shown that even in people who have, otherwise normal blood pressure for the rest of the day, if their blood pressure doesn't fall at night, they are still at a higher risk of death.
Mm,
So, and nobody can check what your blood pressure at night is unless you're wearing a device like this or a 24-hour ambulatory. So 24 ambulatory blood pressure test is where you wear a cuff for 24 hours. And as you know, that cuff will inflate and deflate. And as you said, I was
And
like,
it keeps people up at night. Okay,
yeah,
so we got it, right? We need to know if people are dippers or non-dippers. A non-dipper is at much higher risk for heart disease and heart attacks and early death
yeah,
if it's not identified and managed, which is
yeah.
why we recommend everyone get a 24-hour blood pressure monitor. If you don't want to wear a cuff that goes on and off all day, you can actually join Dr. Carr in her program where you wear an Actia for 2 weeks. She will analyze the data and advise you on the different steps you need to take. If you're a non-dipper, I always recommend medication and I recommend you take it at bedtime, even if it's a tiny dose, because it's very difficult to undo the damage that is done when you expose yourself to high blood pressure. And so, when we say hypertension, we're talking about the tension within the blood vessels. And hypertension or high blood pressure for periods of time change the pliability and the ability of your blood vessels to adapt to flow. And stiff blood vessels are not good. Blood vessels are in your brain, in your eyes, in your kidneys, in the penis, in the feet, they're everywhere. And when you get stiff blood vessels, the blood flow is impaired and then the organ health is impaired. And this is how we accelerate toward early death.
Yes.
Right?
And you
So,
brought up
so let's
something
just
very
talk about,
important.
yeah, so
That's
let's
just
talk about
stepping back,
the,
Natasha. Once we're just stepping back a little because, as you said, many of your patients they are not aware of what untreated hypertension can do. So it affects brain, heart, kidneys, eyes, sexual dysfunction. So these are the most important ones. So every blood vessel in the body is affected, and sometimes people don't realize that it has so many consequences. Unmanaged high blood pressure. So now going back, Natasha, we wanted to talk about hormones. So let's get to
yes, I was just going to ask you that. So why are hormones important? Because as I said, we do hormones in the clinic. That's what people come to us for from across the country, even the US, even Europe. We've got patients in Peru, we've got patients everywhere. And everybody comes for hormones and they think it's because of the menopause or the andropause or the hot flashes or the whatever brain fog they're going through. But we know that balancing hormones actually helps cholesterol levels improve.
oh yeah,
And by the same token, hormones help blood pressure. So,
yes.
can you tell us which hormones are really important for
So
men and
in
women for blood pressure?
in women, estrogen applied to the skin as a cream or a gel, and oral micronized progesterone. So Dr. R and I have lots of videos where we talk about the different types of
Mhm.
progestogen and estrogens. So estrogen that's applied on the skin, it's not a pill to be taken. That can lower blood pressure. But at the same time, I must also mention that if someone has hypertension and they think that only hormone therapy is going to lower their blood pressure, no, that is not
Oh,
what
it's all part and parcel, but I think
it is
one of the
together.
important things to note is that
Yeah,
when people go through hormone changes,
yeah.
that's when the blood pressure can change. So just because you were healthy in your 30s
Oh,
and you didn't think to check in your 40s doesn't mean that things aren't going to change at this moment, right? And so when you're going through the hormonal fluctuation, understand that it's not just the typical hormone things that are going on. And that's why we're so passionate about hormone balancing, because we know from studies that heart health improves with hormone balance. And, I was just listening to a podcast the other day, and they were talking about whether we should pay attention to that theory of the window of
yeah.
opportunity. And my whole point is, do you still have a heart outside the window of opportunity? Do you still have a brain outside the window of opportunity? Do you still have bone? For all of the benefits of hormone therapy, I could care less if you're 70 years old and you've never taken a hormone before. I want you to be on hormones because you want to live the rest of your life as healthy and as full of vitality as possible. And the difference between health span and lifespan, right? And we say health span is how long and well you live. So that being said, we're saying that estrogen and progesterone are important for women. Men have hormones too. So do men's hormones also help blood pressure?
Yes, but again, here is where the type of hormone therapy, like testosterone applied to the skin versus oral testosterone. Oral
Okay,
testosterone,
first of all, we do not use oral estrogen or testosterone in our
no,
practice at all. We
yeah,
will never prescribe it. It doesn't matter how much you beg or plead or what thing you show us, then who said what about it. We never prescribe oral estrogen or testosterone. So we always apply topically, and for
yeah.
testosterone, we can do injectable. So testosterone and blood pressure, Dr. Karp.
And actually, recently there have been studies which have shown that testosterone doesn't cause heart disease risk, increase heart disease risk in men. In fact, on the contrary, testosterone in men has been used to put diabetes into remission. So remission meaning your diabetes is way better than what it was before.
And diabetes is another risk factor for heart disease,
Yes,
but and lots of people with poor blood sugar control have poor
yes,
blood pressure control. So we're saying that hormones improve the vasculature or the
yeah,
blood vessel health,
yeah.
or not improve, they maintain blood vessel health. And so when you're low in hormones, managing your blood pressure and your risk of early death is really and actually outside of blood pressure, hormones help you live longer, better, with a better quality of life and improved health, because people don't realize that hormones aren't for what we always thought they were for, and that they're good for everything from your brain down to your toes. I mean, even how your collagen and your hair and your nails grow is affected by hormones, right? But there is one hormone I want to talk about that people don't often think about when we talk about hormones, because everybody thinks estrogen, progesterone, testosterone. Cortisol.
Mhm.
Cortisol and its impact on blood pressure, and cortisol is the stress hormone. In recent years, I've been spending a lot of, as you know, because in the last couple of 3 years, I've been sending you stuff on the vagus nerve and sympathetic, parasympathetic nervous system balance. I've been talking a lot about heart math and sound therapy and all sorts of things to calm the nervous system. And I really, you mentioned tension and you mentioned stress. But I think one really important thing to mention is you don't need to be under stress at this moment for stress to be affecting your nervous system and your blood pressure. And what's interesting is that the research has taken us so much further now, where we can understand even the tiny chemicals that are released through the nervous system and because of stress that alter our blood pressure, our heart rate, our nervous system balance. And when you're saying lifestyle, people want to walk more, eat less salt, which I know you have a lot of things to say about the salt story. And then they want to do all these traditional things, lose 10% of your body weight, and whatever all those regular lifestyle things are. And you and I mean, years ago, before anybody even heard about MBSR, mindfulness-based stress reduction, you brought it into our practice. You were teaching patients that it exists. You were talking about how important it is. And mindfulness-based stress reduction or meditation are crucial for the lifestyle component of managing hypertension, high blood pressure. But I also think that we should talk about, just briefly, um, or I will comment on the role of past stress and trauma and how it affects the nervous system and dysregulates it, so that even if you're not stressed right now, that impact is still there, and it's something we need to work on, which is why I'm so fond of trackers like you and I wear. We check our heart rate variability. We're looking at our sympathetic and parasympathetic nervous system balance and health. I have to say, I'm so proud mine is improving daily.
Awesome.
Um, right? But it was something I never paid attention to
Oh,
before. So even sleep and quality of sleep affect your overall health, but it affects your blood pressure. If you're not sleeping well, your blood pressure is not going to be healthy. So, while we're talking about lifestyle, let's just talk about some practical things, because I know patients come into the office and they'll say, "Oh, don't take my blood pressure. It's always high here, but it's perfectly normal at home." And, "Oh, I just got here, so it's not going to be relevant." And
mhm.
I'll usually say to them, "Okay, but in your daily life, are you rushing to places?" Sure. So if you're rushing, should you not know what it is when you're rushing? Or you just had coffee. Should you not know what it is after you've had a coffee? And then know your pattern and your trend, which is why the 24-hour monitoring is so much more valuable than just a one time only. But if a patient didn't have access to any of these things and they bought this blood pressure monitor off of Amazon, what are some of the key things they need to remember to say, I've taken my blood pressure properly?
Okay. First of all is the device. So the device needs to be a clinically validated one. And again, I'm not going to spend time in doing that, but you can just do an internet search to find out. So the blood pressure device has to be accurate, the one you people use at home. The next thing is I'm going to show, because there are a whole bunch of pitfalls to measuring blood pressure at home, which people are not sometimes aware of. Now, Natasha, can you see my screen?
Yep, I can.
So here, I think what I will do is make it a little smaller. Can I do that? No. So the thing is, we are supposed to sit on a chair with the back supported, both feet firmly planted on the ground. The forearm should be supported on a table and the cuff should be the right size. Too small or too large a cuff can give inaccurate readings. And sometimes it is like shocking how much of a difference this can be. Now, drinking caffeine within 30 minutes of blood pressure measurement can increase reading. Having a full bladder can increase numbers. So, after checking out all these things, and then we have to take an average of 2 to 3 measurements. Now, recently someone said two. I was very happy because, and I have tried doing all this and I found it most irksome. That is why I'm so fond of a device like this, because then I don't have to worry about all these
It
other.
is quite an investment, though. So it's actually
Yeah.
nicer to be able to just have patients
Check it at
rent
home.
it, use
Yeah.
it temporarily, and
Yeah.
return it. Yeah.
But this is very important, and Natasha, I know that many doctors are also not aware of how all these little things can impact blood pressure. So this is something important to know how you measure your blood pressure. And as you pointed out, Natasha, the thing is, if you are checking, if you are someone who thinks that your blood pressure rises only at the doctor's clinic, yes, that can happen. But the second part of it, Natasha, is the part that does not happen, is they don't go home and check their blood pressure often enough to know whether they really don't have hypertension, whether it
Mm.
was just because they loved your beautiful face and suddenly their blood pressure went up.
Right. So I think people make a lot of errors about have why they should pay attention, or my blood pressure is just high at this moment, but the rest of the time it's fine. I have nothing to worry. Yes, you should worry. So in summary, you must know what your 24-hour blood pressure levels are, because if you're a non-dipper, that's significant for your future risk of stroke, heart attack, early death, right? You're going to die early. 120/80 is the maximum. We do not tolerate higher than that. For diabetics, we go 110/70 as the maximum. Uh,
Women.
and if it's not, then we medicate quickly and early, regardless of diabetes or not. Get your lifestyle in order. So, outside of the weight loss, the walking, the sleeping well, managing your diet, avoiding ultra processed foods, sugars, and all of those things that actually increase weight and whatever other mechanisms, tell us about salt very quickly, please.
Okay, so salt number one is excessive consumption of salt, particularly one that comes from processed food, processed meat. That is not good for anyone. But not everybody has salt sensitive hypertension. So one of the ways to know is to know if your nighttime blood pressure is high on a 24-hour ambulatory, chances are that you might have salt sensitive hypertension. So if you have, first of all, there is no simple easy test to do which will tell you whether you're sensitive or not. So review the food that you eat. If you find that you have a lot of processed food includes processed meat, so sausages, salami, all that stuff, chips, and so go through all the things that you eat and eliminate the ones that are high in salt. Number two is there's something called salt substitution. So table salt is sodium chloride. So if we can substitute some of the sodium chloride with potassium, and then there are caveats. Some people should not, but if you
Okay, we'll
substitute,
keep it simple. Just
yeah,
simple daily
just
guidelines.
substitution of salt can also lower blood pressure. That is another important thing. So that is about salt. And The
Oh, wait,
other,
I have something else to add
yeah,
there because I see a lot of people in the ER who have low sodium and low chloride because they're on a completely
salt.
salt-free diet. And I think what you need to clarify is yes, table salt is suboptimal.
Mhm.
Salt added to processed food is very bad for you. In fact, it's bad for everybody, whether you have high blood pressure or not. Um, but there's natural sea salt, and there's Himalayan salt, and there's Celtic salt, and all these natural salts that have minerals. Um, and I personally tell patients you need to add salt to your food for the minerals, and it's not the table salt because table salt is processed and it's got additives to it. So it's not simply sodium chloride. So I don't think absolute salt restriction is accurate advice.
No, so with salt, there is like a U-shaped curve. Too low or too high, both are bad. So that's it.
Exactly.
There are a lot of caveats to that and who it applies to and a lot of things. But yeah, it's important to know it's not as simple as just stop eating, all this.
Right. So if you're going to use salt, use natural sea salt or Himalayan salt in moderation. If you're a low carb person, you're going to need
Hmm.
salt and electrolytes. And we put a lot of people on carb restriction because they have insulin resistance and they have weight issues. And we know if we drop their weight, their blood pressure is going to come down. So it's avoid table salt and avoid salt that comes in all of your processed foods. But yes, use salt. It's not there to be avoided because, as you said, it's just too much and too little that can be an issue. But right in in moderation is a good idea, especially when I'm seeing electrolyte imbalances in a lot of older patients in their 60s and older because they've been put on a salt-free diet by their, I don't know,
Yeah.
internal medicine person or anything like that, someone like that, or even their family doctor saying just no salt. So, are there any last minute or final comments you want to make to patients about hypertension as we're helping people be more aware of hypertension and all the issues that we face as a population because people are so unaware of it and it's such a silent disease typically?
Yeah. So first and foremost, I think it's important for people to become, to advocate for themselves. Because very often doctors may just say dismiss, and like you said, they go to the clinic, the measurement is high, and then it ends there. They don't go home and check the blood pressure. So if there's just one thing that I want people to go away with is get a blood pressure device, a validated one. They don't cost a whole lot, and check your blood pressure at home, ideally morning, afternoon, and night for at least 3 days out of 7 days. But my point is just check whenever you can. Like,
I say to patients, don't obsess, but don't
yeah.
check at the same time every single day because, again, it's artificial, right? Like if you wake up every morning and you're having your cup of coffee and then you check your blood, okay, forget coffee. Let's say you wake up every morning and you check your blood pressure right when you wake up. Well, then how do you know what it is after you went for a walk, after you came home from work, after you had dinner, whether you exercised or not? Like you need to know your variance in the blood pressure and if you trend high after things and whether it comes back down to normal. So I ask patients to do it frequently whenever they
Yeah.
think about it, but bring me a lot of data
Yeah.
and bring me the data with what you were doing before you took the blood pressure. And okay, so people are going to check them. What I would like to conclude with is your passion about the heart and the brain and your current obsession with hypertension. And I want to let people know that you have a program available
Yes.
for hypertension management. And here you're looking at natural measures, whether it's effective or not in lowering blood pressure or improving blood pressure numbers. And so anyone who has family history of heart disease, has had the odd high blood pressure reading, if they're interested, how will they get a hold of you to get on this program of yours? Because as we said, we deal with a ton of people who don't want to take medication. And here you are all day, all night, creating this program for the last more than 1 year now. You've been working on this, researching every supplement, lifestyle, everything to do with blood pressure, because your ultimate obsession is keeping heart and brain healthy in people. So, how do people get a hold of you, Dr. Carr, for this
So the
particular program to naturally lower blood pressure?
The best way is to email my office at info at the rate drcarmd.com. So info at the rate drkarmd.com. That is the best way. Just send an email saying I want to know more about the blood pressure program
So
and
info at drcarmd.com.
com. Okay. And if you are a clinic patient, live younger, just reach out to the office girls and they'll tell you all about it.
Well, they'll at least hook them up with you for a brief
Yeah.
consult to chat about getting on your program.
Yeah.
Okay, perfect. So, thank you so much, because really we're seeing increased heart disease in younger and younger people. A lot of people, they're saying that, oh, it's just because of the lifestyle and the poor food and the this and that. I think it's so much more than that, but we're going to be seeing people die earlier, faster, and in higher numbers if we don't help patients understand a lot of the things that they need to do to secure their health span so that they can live younger, longer.
Yeah.
So thanks, Dr. Carr, and contact Dr. Carr at info@drcarmd.com if you want to learn to manage your blood pressure better and get on her program.
Thank you, Natasha. As always, it's a pleasure talking to you. And don't forget your hormones, everyone.
That's what we're here for.
Yeah.